All right, welcome back. We keep hearing about these traffic problems around Central
Yes.
Arkansas, and Dr. Scott Davis could tell us firsthand about it.
Yeah, I was biting my nails there for a second.
get
I mean,
here.
it was like a quarter till 9. It's like,
Yeah.
hey, I got a date.
I got to get to Good Morning
That's
Arkansas.
right. That's
Well, we're
right.
glad
But
you're here
there was a
safely.
wreck there on the freeway, but it didn't look like anybody was hurt.
Very
so.
good, very good. Okay, well, we've
Glad to
got
hear.
questions
Let's
from
go.
Facebook,
Yep.
and they need some answers. So let's start off with Crystal, and Crystal asks, my heart starts racing really fast, and my blood pressure goes high, and I get hot. What's causing that to happen, and what should I do?
Well, there's definitely a correlation between heart rate and blood pressure, and not knowing Crystal's age, I would clearly favor having this more thoroughly evaluated.
Sure.
Two things we want to document. Number one is we want to document what her blood pressure is during these spells. So a home blood pressure cuff is a first start. You can get that at any Walgreens, Walmart, but the cuff kind of goes on the arm. Secondly, then, she's going to need some form of rhythm evaluation. We have mobile rhythm monitors that we can have patients wear for 24, 48 hours or longer to capture what the rhythm is. Now, the underlying cause is something that she'll need to kind of work with her doctor, cardiologist, to kind of tease out, to find out what's going on, and then to look at what would be an effective therapy. For instance, she might benefit by being on a medicine that would control both blood pressure and heart rate, like a beta blocker or a calcium channel blocker. I don't want to get too far into it, but clearly I would favor her seeking out getting the rhythm monitor and the heart and the blood pressure, so we can kind of get those two correlated and more thoroughly
How
evaluated.
often should she check her blood pressure at home? What do you suggest?
Yeah, so two things that is the recommendation. We want to know kind of where you're living, right, where your average blood pressure is, and that number is best obtained in the morning when you get up. So, look, if I plot your blood pressure or my blood pressure, it's going to vary during the day. It's like RPMs of your car, right? If you're at the stoplight, it's going to be low. If you're in rush hour traffic, it may be high. So blood pressure does the same thing. It fluctuates during the day. But the morning blood pressure, right when you get up, check your blood pressure, that kind of gives a good measurement of where you're living, where your average is. Then that's one column if you're going to keep it, right? Second column is whenever you're symptomatic. So like she's noticing, hey, my heart rate goes up and I feel like my blood pressure's up. I feel like, hot or flushed.
Yeah.
Well, check your blood pressure then too whenever you're symptomatic. And then bringing a log to your doctor, whether it's on an Excel spreadsheet or, a steno pad, but a log of, all right, here's the past month of my readings, both baseline and then when I'm having episodes. That helps kind of steer things.
That with the rhythm, you can really put things together.
That's right. That's
okay,
right.
Let's go to the next question, and this one is from Stephanie, and Stephanie says, my heart skips beats every day, and some days it takes my breath away. What could be the cause? Too much caffeine? Many years ago, I was told I had a right bundle branch block. And what does that mean, she asks? Okay,
good. So Stephanie's got a rhythm question too. And first and foremost, we do know that there are certain triggers in our day-to-day that might, tip over the apple cart, causing our heart to race. Caffeine is definitely one of them. Chocolate, some folks react to chocolate certain ways. So it is important that she's kind of identifying maybe environmental stressors that might be kind of pushing the button there. Again, like we said with the last individual, we want to correlate heart rhythm with episodes. So some form of rhythm monitor would be indicated here, whether she gets that through a primary care doctor or through a cardiologist. A bundle branch block, that term relates to the rhythm, the spark plugs, the electrical system, not the circulation, not the artery, the plumbing. That's right. So that would be something that would be picked up on an EKG and then would certainly go into play as far as further evaluation. A right bundle branch block is not uncommon. I mean, long distance runners can have it. We can see it not uncommonly. So I wouldn't get too worked up about that. But the symptoms that she's having, I think, would be benefited by a little more thorough, more formal evaluation.
Yeah, she's also probably going to go to the Holter monitor.
That's right. That's exactly right. That's exactly right. And so then the way that works is it is a monitor that one wears, but it keeps you mobile. So you're able to go to work and interact with your family, and yet it gives us a window into what the rhythm looks like. In addition, there's a diary. There's a monitor or an event piece so that you can click a button or you can make a notation, an entry into the diary saying, you know what, at 10:15 last night I had an episode. So that then the doctor can go back and look and go, all right, 10:15, here's what was going on with your heart rhythm. Yeah.
Okay.
Very
great
beneficial.
rhythm questions, because I know a lot of people have these
You
all
bet.
the time and they worry you. Let's put up the information about Baptist Helpline. It is 1-888-BAPTIST. Easy to remember. Jot it down, or just remember 1-888-BAPTIST to give them a call in case you have any questions. You think you need to go see one of the doctors there. Thank you.
Great to see you.
Good to see you. Hope you have better traffic.
No kidding.
Going back to work today.
No kidding.
Okay, coming up.